Good morning, everyone. Welcome back to Atlanta & Company. Are you looking for a doctor here in the Atlanta area? Be sure to pick up the newest edition of Atlanta Magazine. The July issue features the top physicians in over 50 specialties. Here to tell us more about what's inside, president and publisher of Atlanta Magazine, Sean McGinnis, and featured in the issue, DJ Papadopoulos from Metro Derm. Welcome, doctor.
Thank you very much. Thanks for having me.
Of course, and good to see you as always,
Good to see you again,
Sean.
Christine. How are you?
I'm doing great. Before we actually get to doctor and learn more about Metro Derm, tell everyone about the issue and why this is so important.
So this is something we've been doing for years, decades actually, and proof in the results, it's one of our most popular issues by far. So this is our annual Top Doctors issue. This is a peer-to-peer survey. So this is not a popularity contest among consumers. But it's doctors actually voting on other doctors who they would recommend, as you mentioned, in over 50 different specialty areas. 700 doctors plus are listed in the issue, plus some great profile pieces. We've got an Emory doc featured. We call him our version of Dr. House. Yeah. Kind of the sleuth of Emory medicine.
Super sleuth.
Another great human interest story about a doctor, orthopedic surgeon who has 3 daughters, triplets, who all followed in his footsteps and are in his practice now.
Incredible.
So, a great resource.
Yes.
You know, with Atlanta growing as it is, we're seeing an influx of new residents any given time. So it's a great resource that people like to hold on to throughout the year.
Absolutely. And doctor, you're featured. Tell me more about Metro Derm and what you do there.
Metro Derm is a large dermatology / plastic surgical practice. We have general dermatologists, we have dermatopathologists, we have 3 Mohs surgeons, plastic surgeons, a vascular surgeon actually is part of our group as well. We've been in existence since 2003. This is our 15th year, and we have 4 locations in the Metro Atlanta area, and see lots and lots of patients.
And this is such an important time of year. We talk about sun protection, everyone knows, but let's kind of get back to the basics, if you would, for us. Skin cancers, we know there are several different types. Can you walk us through them, you know, from the most benign to the more serious melanoma?
Sure. So the 3 basic types of skin cancers are basal cell carcinoma, which is by far the most common of all skin cancers. Squamous cell carcinoma, which is the 2nd most common skin cancer, tends to occur in people that are older with significant sun exposure. And the worst of the 3 is melanoma, which accounts for about 9,000 to 9,500 deaths per year in the United States. If you look at the incidence of all skin cancers, they have literally from the 70s till today gone dramatically, have risen, and especially melanoma. We in the 70s had rates of about 5 per 100,000 people. We are now at 23 per 100,000 people in the span of 40 years.
Wow, so scary. I know my husband loves to play his golf on the weekends, and I'm always, don't forget your sunscreen. And people sometimes, you know, you just put it on quickly, you forget your ears, the back of your neck. So it really is so important to use your SPF, even when, if it's a cloudy day, right? Just simple tips like that.
Absolutely. I mean, I think it's really important to use sunscreen, but it isn't the only thing. I think one of the things that we preach to people, especially if they're at high risk, is sun avoidance and really wearing a hat, protecting themselves, staying in the shade, avoiding the sun. You know, sometimes by using sunscreen, people have the false sense of security that I'm going to use my sunscreen and I'm going to just basically be out in the sun for as long as I want. And I don't think people should do that. I think it's important to exercise many other precautions as well.
Right, and then a lot of people may wonder common causes of premature aging, not just the sun. What else?
Well, what we tell people is, you know, you're here, especially for women in particular, we tell them, you know, you're here because I'm checking you for skin cancer, but from a cosmetic standpoint, you're really hurting yourself if you're out in unadulterated sun without protection.
Right.
If you're fair and are doing that, you're really hurting yourself. And you're going to be spending a lot of money trying to correct those things in the future from an aesthetic standpoint.
Absolutely. And it's funny how far we have come. I can look back at pictures in the 70s, and I'm like, who's that child that looks like a, you know, tomato? And it's me. You know, we weren't protecting ourselves back then. So now to have to reverse it, what are some of the procedures in your office that you recommend?
I mean, there are tons of procedures. One of the most common things that you can do is obviously sun avoidance.
Right.
The second thing is the use of topical retinoids have really, really helped a great deal. Then there are other procedures like chemical peels, and then devices that have been used that I think are sometimes over promoted, meaning laser
Yeah.
devices. But I also feel that they have a place. And then if you really want an extreme therapeutic option, it would be to do facelifting and interventional type of work.
Right. Well, thank you so much. Tremendous information. And where can we go to learn more about your practice and perhaps come see you at the office?
Well, the easiest place to go to www.metroderm.org, and you can get a whole bunch of information there. And we have our locations posted there, and we would love to see you.
Well, thank you for the great tips and advice. And Sean, always so good to see you.
Good to see you too, Christine.
We can pick up that issue
On newsstands
today.
now. Yes.
Awesome. Thank you as always. Once again, I'll tell you if you want to look for that top doctors list, it's the July issue, atlantamagazine.com, or for more information about MetroDerm, as Doctor just told you, it's metroderm.org. Well, coming up, a refreshing